Hi, today we'll be discussing a recent large retrospective study that looked at a possible link between the presence of endometriosis and risk of ovarian cancer. The authors also looked at association between different phenotypes of endometriosis and different histotypes of ovarian cancer. I am referring to a study recently published in JAMA by Barnard and co-workers in 2024. The authors looked at a large population database, including almost 80,000 women with a diagnosis of endometriosis, matched in a 1:5 ratio with women without the disease at a span of around 30 years between 1992 and 2019. In short, the main findings of this study are that women with endometriosis have a 4.2-fold higher risk of ovarian cancer, and particularly those women with the more severe forms of disease, namely ovarian endometrioma or deep endometriosis, have a 9.7-fold higher of ovarian cancer. When they looked at different phenotypes and different histotypes, they identified, and this is particularly important, that for the strongest association was between deep endometriosis or ovarian endometrioma and type 1 ovarian cancers, meaning endometrioid, clear cell, mucinous or low-grade serous ovarian cancer. They found that women with deep endometriosis or ovarian endometrioma have a 19-fold higher risk of developing type 1 ovarian cancer, whereas the same group of women with deep endometriosis or ovarian endometrioma had a 4-fold higher risk of developing type 2 ovarian cancer, namely high-grade serous ovarian cancer. The other interesting finding of this research is that the risk appeared to follow a rather U-shaped bell, meaning that the risk of developing ovarian cancer was higher during the first 5 years of the follow-up or after 20 years from the initial diagnosis of endometriosis. Of course, the topic of a possible link between endometriosis and ovarian cancer is not new. We have studies around it. I will refer to a couple of those. A fairly recent, in 2021, thorough systematic review and meta-analysis by Marina Gazbok and others, which identified that women with endometriosis have a high risk of clear cell and endometrioid ovarian cancer. The only original study that I'm aware of that looked at different subtypes, phenotypes of endometriosis and different histotypes of ovarian cancer comes from Finland, Savalainen and co-workers, which identified that women with ovarian endometrioma have a higher risk of clear cell or endometrioid ovarian cancer within 5 to 10 years after the index surgery. They also interestingly identified that women with peritoneal endometriosis have a higher risk of endometrioid ovarian cancer. However, those with deep endometriosis in that study from Finland did not have a higher risk of ovarian cancer. However, there were only 3 cases of ovarian cancer in this study. Limitations of the study I'm discussing today, the one by Barnard, published in JAMA, have to do mostly with the inherent limitations of the diagnosis of endometriosis, the lack of non-invasive screening, and potential miscalculations of different endometriosis phenotypes and different ovarian cancer histotypes. The main strength of this study is, of course, the large number of patients using a large population database in Utah, United States. The main conclusion of the authors based on that finding is that because they identified a strong association between deep endometriosis and ovarian endometrioma and type 1 ovarian cancers, they feel that this particular subgroup of patients, those with a more severe endometriosis, may be a good population for targeted ovarian cancer screening and potentially some prevention studies. Per Personally, in reading this research, I feel that we have a fair amount of evidence out there that there is possibly an association between history of endometriosis and ovarian cancer. The numbers, of course, remain low of ovarian cancer in those women. However, I do feel that that needs to be included in our consultation with our endometriosis patients to make them aware of that higher risk. How I deal with it, I personally agree with the authors that targeted cancer screening in this particular population is of importance. The authors do not recommend which or what type of screening should be followed, and I also feel that this largely will depend on the availability of each healthcare setting, the financial constraints and all that. But it is important to acknowledge that those women with severe endometriosis should have some form of ovarian cancer screening. This is my view. What we desperately need as data, I personally feel, is the impact or the potential impact of various endometriosis treatment modalities to that ovarian cancer risk. How, for example, radical endometriosis excision surgery on the ovaries or any other location of endometriosis may potentially reduce that risk of ovarian cancer, because unfortunately up to this moment in time we have conflicting evidence on the impact of surgery on the risk of ovarian cancer in those patients. Thank you.